Good morning, ladies and gentlemen, and welcome to Taiwan. Today, I will present Taiwan CDC to present the topic of surveillance and control of enterovirus in Taiwan. As the previous Dr. Lee speak up, the first enterovirus outbreak is in 1998. There is a very large outbreak in Taiwan, and the total number of hand-foot-mouth disease and Herpangina cases recorded was 129,000. This is a very big, huge outbreak, and I think it's the first to be noticed outbreak. And during that outbreak, that resulted in 405 severe cases in children and 78 deaths. And the deaths, most of them are children under 5 years old. And during that, most of the cases died within 1 or 2 days of the admission to the hospital. So they died very quickly. And EV71 was the primary agent. So this outbreak resulted in very panic in the society. So, and also pushed the establishment of Taiwan CDC in the next year. Before, we have 3 separate. One is for laboratory, and one is for prevention medicine like CDC, and the other is quarantine. And after the 1998 enterovirus outbreak, CDC established in 1999, July 1st. So let's talk about the enterovirus in Taiwan. Taiwan, the enterovirus shows a seasonal epidemic. It often started in late March and peaked around in mid-June. And then the epidemic will wane when the summer vacation came. Then a small outbreak was in September when the school reopened in September. In all the enterovirus infections, only EV71 will account for most of the severe cases of the children under 5 years old. And the epidemic will occur every 2 to 4 weeks. And the next outbreak is around 2008. So we are very anxious now because there may be in 2012, and now this is 2017. So we are preparing for the next outbreak for EV71 for around 2 years. But fortunately, since the epidemic is not open yet, still not. And in Taiwan, EV71 with complicated cases were listed as our Category 3 notifiable disease, and the physician should report cases within 7 days. And according to the previous study, the non-polio enterovirus causes a high burden of medical events and caregiver productive loss, and still a big problem now in Taiwan. You can see this is the number of weekly outpatient and the emergency department visit for EV71 from 2008 and 2017. You can see the seasonal epidemic. Usually, this is a summer disease. It started from April and then ended in July, for just as I said, when the school summer vacation started, and a small peak in September. Most of the years, this shows the seasonal epidemic. So in Taiwan, summer we care about enterovirus, and winter we care about flu. This is the usual pattern in Taiwan CDC's work. And we have the laboratory diagnosis and Sentinel testing for the serotype. So this is usual. And as I said, EV71 will occur every 2 to 4 years. So after the 1998, this is 2005, we have a small outbreak. And 2008, we have small outbreak. And 2012 here, we still have outbreak. So now it's another 4 years passed. So we are very nervous for these 2 years since there will be another outbreak for EV71. But till now, seems okay because this summer is already over. Began to fall. So this year maybe we can, fortunately, didn't have. The next summer will be another year to be worried. And for the enterovirus infection with severe complication, this is a noticeable disease. This is the definition. We surveillance for two kinds of disease. First is patients with Herpangina or hand-to-mouth disease, but they are accompanied by some severe complications such as myoclonic jerk or encephalitis or acute glycemic paralysis, acute hepatitis, and etc. This is the first type of reporting. And the other is we would want to report cases in infants under 3 months old if they have myocarditis, hepatitis, such severe complications, also have to report. And when the clinician finds the person and confirms the definition, they should report cases with the information and also submit specimen to Taiwan CDC. And then we will calculate an investigation if this case is fulfilled for the definition. And the EVSC were all the cases were surveillance in our system, in a real-time system. So every day we will know how many cases are reported and how many cases confirmed or excluded. In this way to monitor the severe cases in Taiwan. Annually, the case number you can see fluctuated very big because when there is an EV71, the EVSC number is very high. But if not, the EVSC was very small. So the case mortality rate always will fluctuate when in the new, like in 2015, we only have 4 cases. And if one died, the case mortality rate will reach about 33%. But the case mortality rate fluctuated as the number fluctuated. And most of the severe cases were under 5 years old, especially under 1 year old. That's accounting for around 63%. And only 6% case is cases over 5 years old. As the serotype distribution of the severe cases, you can see 84% is belong to EV71. Among deaths, 72% is belong to EV71. Other types only accounted for very small proportion. So, as the previous study with Dr. Liu from Taiwan CDC, he just mentioned about the economic impact. He would have separate for medical costs and non-medical costs. In medical costs, only for complication acute phase or unfavorable outcome in this way. But when a child has enteroviral infection, we have to have productive loss due to the premature mortality, and also the caregiver has traveler fee, and caregiver productive loss is a huge burden. So in this non-polio enterovirus in Taiwan still is a major event for the public health. But there are some challenges for control of enterovirus. First, we know the enteroviral infection has multiple transmission routes. It can be found in the GI tract and the respiratory tract. And so the infection can be produced through the direct contact with the secretion or with the contaminated surface of the agent. And in the kindergarten, you know the children always play together, all the toys play together. So this is very difficult to maintain the disinfection. And another problem is the patient has very long infectious periods. Patient is contagious before symptom onset, and the infectivity can last for weeks after the patient is recovered. So this makes the prevention even harder. And till now, there is no highly infectious medication to eliminate the virus. So all these 3 points make the prevention and control of enteroviruses very difficult. And we hope to have a preventive vaccine, but now in Taiwan it is not yet available. So for the control of enterovirus, first we have to have a comprehensive surveillance system. So let me introduce our surveillance in Taiwan. First, we have a Sentinel surveillance system. The surveillance system for the mild disease like Herpangina and Herpangina. First is the Sentinel surveillance system. This is started in 1998 until 2009. There is over 500 reporting clinics that will report outpatient for these 2 diseases weekly. And since 2006, we developed another system. It's a real-time outbreak and disease surveillance system, which is ROS. It will collect data for the emergency department visits, the ICD-9. We will, every 10 minutes, just collect the ICD-9 to the Taiwan CDC. And our system covers 90% of the national emergency departments. So we will soon know how many patients come to the emergency department is due to the enterovirus infection. So this ROS system is very helpful in our surveillance system. It started in 2006. And we know the enterovirus not only come to the emergency department, the other way is to the outpatient clinic. So we started cooperated with the National Health Insurance to have the outpatient clinic claim data. And then we can see how many outpatient visits is for the enterovirus. And the National Health Insurance covers 99% of the population. So we can have a very exact number how many patients come to the medical facility for enterovirus. And the data exchange is daily. So let me show some data. This is the Sentinel surveillance in the beginning. So we can see that in the Sentinel system, we monitor 3 cases. First is ILI, and the enterovirus is the red line and the diarrhea. Through this to know what's happening in the community. But since 2006, we have gone further. This is the ROS system. You can see the time and when. And also we can see the different part of Taiwan will have a higher outbreak in enterovirus. And then this is the outpatient clinic. You can see such surveillance system we can help each other to understand what happened and how big of the outbreak of enterovirus epidemic in the community. So through this system, we can know if the enterovirus season begin or not. And also we have a very strong laboratory diagnosis system. Now we can have virus RNA and serology. And turnaround time very quickly. So through our effort and all the efforts, now the ratio of untypable EV is less than 10%. And I think this section will be introduced by later on Dr. Yang present. But through the laboratory reporting, we can collect the present type, main serotype in the community. Like this morning, our morning meeting for the all the CDC routine meeting, just to report that present in our community is the Coxsackie A6, not EV71. So every week, we will check our epidemic to understand if sometimes the EV71 came up, we will know it will be an alert, alarming for the epidemic. So through the health education, through the surveillance, then our control measure first is health education. And the different targets will have different goals. For the caregivers for under 5 years old children and the daycare staff, we want them to know before season, they have to know what is good hygiene, how to correctly hand washing, and also how to disinfect the environment. And for medical professionals, we want them to know if there is any cases, they have to know what is the epidemic alert, and they have to know the prodromal cases or the severe cases. When the season comes, our health education goal was to let the caregiver to know what is the prodromal system for severe cases and send the children to the hospital as soon as possible. And let them know, please don't go to school if you got sick. And for the medical professional during season, they have to know many things like the tiny transfer and nosocomial infection control and the prodromal symptoms for the severe cases. So this is our health education goals during different seasons. And the risk communication with the different target, we have different ways. Like to the general public, we usually using the press release and some media. And we have like FB, and we have press. And to the professional, we have a medical correspondence letters. And also, we have cooperation with the private sector, like McDonald's. We have collaborated with McDonald's for about 10 years for the hand washing campaign. They can go to every primary school to have a hand washing campaign and make all the children happy to know how to hand washing. We have a 5-step to hand washing, and they give some small gifts and let them know how to hand washing. So this campaign is very successful. And we have a song. Sorry, I can't sing for you. So we have a song for hand washing. Every children in the primary school have to know how to hand washing correctly to prevent the enterovirus. And we have many posters and pamphlets to educate for all different targets. Besides, we ask the public health department to inspection of the public gathering places to know if they have hand washing facilities and they have disinfection preparation. If there are chloride water prepared, is okay. This is all the inspection. And we have a 727 standard for class suspension, which means this target is the EVSC high-risk group, is the preschool education and care institution. If 2 or more children in the same classes are diagnosed as EV infection within 7 days, the class should be suspended for 7 days. And this, we also monitor the classes suspended weekly to know if there is an outbreak. Finally, is the healthcare system preparedness. We have constructed a medical surveillance network to care for the severe cases. And we also produce the treatment guidelines and the online courses to deliver the knowledge of the EV case management. So all this is our control and the surveillance system in Taiwan. And thanks for your attention.